Ready? Alright, my name is Dylan McGuffin. I'm with the LDCC Paramedic Program, Washita Parish Fire Department. I'm going to be showing you guys how to do a pediatric assessment today, just a traditional medical assessment. We're going to assume our patient's healthy. This is something that he would probably have done in his family doctor's office by a regular physician. It's good to have one of these one a couple times a year, something like that. Just kind of preventative measures. But we're going to start out BSI, seeing safe. I got my gloves on. The first thing I'm going to do when I walk in, I'm going to talk to the patient. Hey man, how you doing? I'm Dylan. I'm a paramedic. I'm going to be giving you a physical today and trying to check some things out, make sure you're healthy. And I'm noticing everything from the way he responds, his eyes. Can you hear me? What does he say? Are his words good? Do they make sense? Are they jumbled? Making sure if he's making eye contact, depending on his age. If he's of older age, like somewhere between like 5 and 10, is he looking at me? You know, as a teenager, is he looking at me? If he's younger, I'm not so much worried about that. But if he's of age, make sure he's oriented at time, place, and person. And we're gonna ask him some questions about his recent memory, maybe some long-term memory questions. Like, man, what'd you have for breakfast today? How you been feeling past couple days? You know, do you know when you were born? When's your birthday? You know, just things like that. Do you remember when your little brother was born? Testing long-term and short-term memory. And then we get a good baseline set of vitals. We'll get a blood pressure, check his pulse. We'll go all the way. What we'll do is we'll check his brachial pulse, his radial pulse, his carotid pulse. Then get a pedal pulse and popliteal pulse as well. Check his respiratory rate. Get some end-tidal CO2. See if he's blowing off CO2 really well. Check his temperature. Temperature's big. And his O2 sat. We'll check his cap refill as well. That's big on pediatric patients. He's checking the cap refill. It's a very good vital sign. Go ahead and get his height, weight. If they're a child, you know, we're looking at length. When I say child, I'm talking about like a toddler, maybe a baby that can't walk yet. We'll get to the length of his way down. Weight. Baby's got a good head circumference, good head size. Also, too, whenever I'm looking at them, I'm looking at their skin color. Is it pink? Are they cyanotic? In their extremities, are they getting good blood flow? And that's where I'm checking cap refill, checking the moisture, skin turgor. When I'm pinch up on their skin, on their arms, make sure they're not dehydrated, their nail beds, all that good stuff. Then we're going to start head to toe examination. I'm checking scalp, looking at their hair, make sure everything, the integrity of everything is good to go. Face, eyes, whenever they look at me, you know, we got a good reaction. Can they follow my finger back and forth when I make the H? Dilation, constriction, color, make sure the eyes aren't bloody, make sure they're looking at me. And then ears, you know, can you hear me? We're gonna look in the ears, make sure everything's good to go there. Make sure the ear canal is clear. Looking at the nose, we're gonna fill on the nose a little bit. Look at air movement in and out. As far as mouth's concerned, they have a gaping jaw. Whenever can they chew? We're going to check that motor function. Just make sure nothing hurts whenever they open their mouth. And if they listen to me when I do ask them to open their mouth. Then we're going to look at the neck, make sure the trachea is midline, make sure we still got good carotid pulses. The head movement up and down, side to side. Jugular veins, make sure they're not distended. Then we're going to go on down to the chest. We're going to check out his clavicles, make sure everything's intact there. Ask him to breathe for us. Make sure that he's got good expansion on his chest. Make sure his ribs are intact. Make sure there's no crepitus or anything like that. And we're also going to listen to our lung sounds. Make sure everything's clear. Make sure there's good movement of air there. We're going to listen to bronchial sounds, bronchosexual sounds, all the different kinds of lung sounds. We're going to go down the list. We're going to work on those. We're going to listen to his heartbeat as well. S1, S2, apical pulses, arterial pulses. We're going to check all those pulses. Make sure everything's good, strong, good rate, nothing's thready, everything looks good. Then we're going to work our way. We're going to examine the abdomen. We're going to listen to the gastric sounds. We're going to listen for anything abnormal. We're going to do a little palpation. See if there's any kind of rebound tenderness in the four quadrants. Use both of our hands while we do that. Make sure nothing's tender or distended. And while we're there, we're going to go ahead and check his back. Then turn around. We lift up the shirt. Make sure he's got good spinal integrity. Make sure there's no bruising or anything crazy like that. So we don't want to see anything bad back here, cause some major issues. And then check his pelvis stability. Make sure nothing is loose there. Make sure everything's good. We check his genitalia. He's a boy. You know, we're looking, checking to make sure that his penis is intact. You know, this is a girl. Make sure that there's no signs of abuse or anything like that. As far as like musculoskeletal needs, making sure that he's good. We can make sure he stand up, make sure he can move his legs, make sure he moves his arms, do flexion and extension. Can he grab my hands? Can he hold his hands out in front of him, his arms? Make sure all those good neuro functions are good. We ask him to stand up, stand on one leg, check his balance, look at the color in the extremities, make sure everything's good there. Like I said, checking distal pulses all the way back inwards to the torso. Making sure that the integrity of his arms and legs is there. And then we're going to be done with this station.